Hey everyone, welcome back to the channel. So today what I'd like to talk about is I would love to help you be able to figure out how to tell whether your pain is a specific pain or whether your pain is a referred pain. And I think it's a really important topic to understand if you have any type of pain, because clinically as a physical therapist, what I see a lot is we see a lot of people come in with what they think is one issue, when in actual fact they have an issue here that's being caused by something somewhere else. And that something somewhere else is traditionally the spine. And I'll get to why that is in a second. But it's really important, because if you can work out, or if you know what a referred pain feels like and what a local specific pain feels like, then you don't have to waste your time treating one thing when you could be doing something else. Or if you're doing it and you need to do this, then you'll be able to emphasize the effect of that by treating the cause of that, the root cause of that. And it's something that I see a lot as a physical therapist, because I've had a large number of people over the years who have come in, some after surgery, injections, lots of medication, even physical therapy, a whole lot of treatment options being focused on this one particular area, when in actual fact, they've had this other problem that's been referring pain to that area, but because this area doesn't hurt, or it doesn't send up a signal to let you know to look there, then it's missed. And I'll never forget, I had a patient, there's a lady who came in who'd had a lot of pelvic pain. She'd had surgery for that. They operated on her, and she came in to see me a couple of weeks later, and she just wasn't satisfied. Her pain felt the same. She said it went away a little bit to begin with, but she'd effectively come back in exactly how she felt before. And this was the first time that I'd seen her. And what we did is we actually found that by pushing somewhere else and by treating somewhere else, not only were we able to reproduce her pain by doing that, but by treating that, we could both see in real time that that pain that she'd been struggling with for months just started to melt away. And obviously it took a few sessions to make that stay away and to correct a few of the things she needed to correct. But the point being is that she had something as serious as pelvic surgery to address what a lot of people thought was the issue. But in actual fact, the symptom that she was complaining the most about was coming from somewhere completely different. So hopefully at the end of today's video, you'll have a good understanding of what sort of more local pain feels like versus a referred pain, and how to notice and pick up on the differences. And then we'll talk about where most referred pain comes from, and we'll give a few examples along the way. So stick around for that, and hopefully you'll be able to take these lessons into your day-to-day life. And then whenever you start to feel uncomfortable or sore, you can automatically say, right, well, I've got a feeling that this may not be all that it seems to be, and we'll go hunting somewhere else, and you can address those problems in real time yourself without needing help, hopefully. So before we get into it though, in order for these videos to reach more people and for this channel to thrive, we really need sort of your help, your interaction. So if you would consider subscribing below if you're new, and if you do go on to enjoy the content and you find it useful, I would really appreciate it if you leave a like below. Again, it just helps these videos get out to more people, and in turn hopefully help more people, which is what they're for. So if you could do that, that would be great. So moving on then. So the idea of referred pain is really, really important, because the underlying, I guess the foundation of this concept is that pain often comes from somewhere else. And the nervous system is key here. So the nervous system with your spinal cord and the peripheral nerves that go out to every part of your body, those neural connections mean that everything is connected intrinsically. So if there's a level of the spine that becomes overloaded, irritated, dysfunctional for whatever reason, and it reaches a point where your body starts to feel a little bit threatened by that, that part of your spine may not necessarily generate pain. It may not be something that your body deems, it may not be threatening enough or disastrous enough, is probably a better word, to make that locally painful. But what it can do is the signals can get confused, for want of a better phrase, because at anywhere that specific level of your spine connects to with the body or supplies via the nerves, has the potential to become painful. So what we want to look out for here, and the hallmarks of referred pain, and I'm sure you've had this before in one way or another, and you'll understand what I mean in a minute, but the hallmarks of referred pain is a pain that feels hard to localize and hard to put your finger on. And it can often be more of an aching feeling or a burning feeling or a pressure or something where you have a feel around and you don't quite feel confident that you can put some pressure on and find that spot that hurts. A common phrase that a lot of people sort of reference unknowingly about referred pain is it often feels deep. It feels deeper than what you can get to. So if you have some pain around your pelvis and you're poking around where it feels sore, where you think it feels sore, and you can't quite hit it, it's really common for people to feel like, oh, it must be deeper because I can't quite feel that. And while in some instances it obviously can be, some deeper structures can be a problem, ultimately what we find is once we start treating the spine or the spinal levels that connect and control those areas, you can start to see a reproduction and a resolution of those symptoms. So if you ever feel like your pain is deep, then this video is hopefully going to be quite useful for you. Another hallmark of a local pain is it is easy to pinpoint. And it often comes from an obvious incident. So you knock something, you get hit by something, you damage something, and you don't have to guess. A lot of the times with referred pain, it sort of comes on gradually or insidiously, as we say, often without warning. And when you suddenly feel that discomfort or that pain, you're often left scratching your head saying, look, I must have done something wrong, or I must have done this or that and not paid attention to it. Because it can be confusing because you have pain in an area that you didn't realize you'd done something to. So it's confusing as to why it's become sore. And that's another hallmark of a referred pain potentially. So if you can then go looking for the spinal level again that corresponds to that peripheral area, then by treating that area, you can then see if that affects a change. You can have some real control and some confidence that there's no mystery around those pains. So I think the two things that a lot of people with referred pain experience is it's more of a vague, hard to pinpoint pain, and it can often feel deep. Again, it can often feel an achy feeling, it can be a burning feeling, a tightness, a pressure. There's a lot of these vague symptoms where that you don't necessarily feel like you've got this very specific, localized area of pain to deal with. So the interesting thing about referred pain, and I'll probably use maybe 3 or 4 examples here to highlight this, is in order to guarantee that you know that it is referred pain, it really helps to know how to self-treat. And we've gone through a video before on how to use the ball, a ball, a tennis ball or a cross ball, and I'll link it up here. There should be a little eye that pops up. But what this is really useful for is if you know that you have some discomforts, you can use a ball to go hunting up and down both sides of your spine to see if you can find a spot that either reproduces or reduces your symptoms so that you know exactly where that's coming from, so that you can then try and address that yourself. Or if you're not confident, you can take that information to a physical therapist and say, look, I put some pressure here and this pain got better or worse. Can you please help me with that? And they should have all the tools to help you address that long term. So I think the 2 main ones to touch on, the first one are headaches. And again, we've done a video on this before, but from my experience as a therapist, a large majority, at least of the headaches that come in to see me, and granted, they're probably the ones that have already passed through maybe your doctor and you've had some scans and they may have caught the really nasty ones. For everyone else, it doesn't necessarily have a sinister cause. There's 2 or 3 levels at the very top of your neck that have nerves that supply and refer and can refer pain and symptoms to your face. So if you get that stereotypical pain behind an eye, pain across the forehead, even jaw pain, if you get an achy jaw, a band of pressure across the base of your skull, tightness, there's a whole range of facial symptoms that often just come out of nowhere and you're left scratching your head trying to understand where they're from. If you can get the ball out and place that up into the base of your skull or at the top of your neck, leaning up against the wall or lying down flat, and just sort of subtly move the ball down a little bit, out to the side a little bit, down a little bit, out to the side. Just see if you can find anything that feels stiff or tight, and then compare it to the exact same spots on the other side. And as we've talked about a lot with these videos, if you have a pain behind this eye, it doesn't necessarily mean that it's the same side of your neck which is the dysfunctional side. Well, it's definitely the side that's referring pain, but where you need to treat, can be the other side. So if you put some pressure on the right-hand side of your neck, so the right-hand side for me here, and you feel like that increases your headache or your symptoms, that's clearly the area that's become overloaded and irritated enough to express itself in that way. But if you were to put the ball on the other side and it actually felt stiffer and tighter and more restricted on the other side, that's actually the side that you need to treat to unlock everything. So yes, that right side or this side has become dysfunctional, but potentially that's become dysfunctional because the stiffness and the tightness has forced that to happen. So just a little sort of a hack there. We want to prioritize your treatment on the side that feels the stiffest. So, but you still want to check both sides so you can feel comfortable that you know without a shadow of a doubt where your symptoms might be coming from. And what I find a lot with my patients is if I'm trying to mobilize their spine and they think something's connected, they think maybe there's something happening, generally it is. So if you do the same thing with the ball and you think, look, maybe my headache or my referred pain's dropped off a little bit, or maybe it's a little bit worse, I'm not sure, there's every chance that it has, and you want to keep pulling that thread until you get to the center of the problem. And obviously moving up and down, depending on where you feel that stiffness is, can be a really strong way to attack the cause and the source of that referred pain to your head, which we often term a headache. So that's one of the main ones. The second one is, again, it's another video that we've done before, so I'll link it up here, but one of the most interesting things that I've found as a physical therapist treating back pain, and particularly lower back pain, is that the base of your spine seems to be it's a really unique pain because it can actually be referred from another part of your back. And it's the only area, so that band of pain across the base of your back that a lot of people can get, or pain that sort of radiates into one hip down to the side, it often has a more central spinal cause that's higher than where the pain actually is. And this is a great source of frustration for a lot of patients who come in with lower back pain, and this term and this label of lower back pain. They may come in with an MRI or an X-ray that says that their disc is bulging or worn down or arthritic, or there's some joint wear and tear or a nerve that's getting annoyed. And because it's underneath that band of pain, we're very quick to say that that's the cause of their pain. And again, similar to the lady who had pelvic pain, she had a very similar presentation where she had this band of pain down low, but deep into her pelvis, and they looked at her pelvis and looked at her lower back and discs and joints and had those operated on. But the source of that referred pain was actually higher up at the base of her rib cage. So even though her pain and symptoms were down low, it was vague, it wasn't very specific. It could be sharp as well, but it was a more dull, deeper feeling, hard to localize pain. As soon as we came up to the base of that rib cage, which again has a bunch of nerves and connections and neural connections to that pelvis and that lower back, as soon as we decreased some horribly stiff joints in her back, her pain went away. And as I said, it came back a little bit because those joints weren't completely loose, but once we'd spent some time freeing that up and putting her in a better position, her pain and symptoms went away. So the second part of this, I guess, story is to say that band of pain, or pain that sort of feels more vague on one side and goes down into the hip potentially, there's a spot higher up in the middle of that back towards the base of that rib cage, which can be the source of all of that pain. So if you want to roll onto a foam roller, have it going sort of lengthways, or again, getting the ball out and letting it press into that section, so not quite in the middle, but just off to the side, and running through the same protocols that we said with the neck, where you're looking for the side that feels the stiffest and the tightest, because that's going to direct where you treat, but also making sure that you're not missing the spot if it's on the other side that may actually increase the pain that you have. So again, we're looking for that confirmation, so you don't have to trust anyone, you don't have to guess. You know that by putting some pressure on a stiff, restricted part of your spine has a positive effect on the pain that you currently have. And then there's no guesswork, and you can tell exactly what it is and where it's coming from. So they're the two main things that we see a lot clinically. Just to touch on two more before we finish up, the base of the neck and the top of the upper back have the nerves that supply and control your arms. So traditionally, if you feel any sort of tingling in your fingers, again, like an achy feeling through your thumb, that the RSI sort of stuff, particularly some tennis elbow pain down the side there, that can come specifically from the base of your neck. And it's the same thing with the lower back. If you do feel an achiness into your legs, particularly into your feet, it may be that lower back from the base of your spine to the base of your rib cage and a little bit higher that's generating that referred pain. So as I said before, it's really important that you can make that distinction between a local pain where there's actually dysfunction there. So if I stub my toe or hit my thumb with a hammer and that hurts, you know that that's where the pain's coming from and you can treat that accordingly. But if you wake up one day and that thumb just feels achy and sore, then it's very important that you look at the base of your neck and the top of your upper back to see if there's some local dysfunction here that's expressing itself via pain to the thumb, because it's the area that connects to it. So I just thought that might be interesting for those dealing with pain, particularly back pain, headaches, arm and leg pain at the moment, where they don't necessarily have the answers that you're looking for in terms of what it is and why it's there. So it's a useful conversation I have with my patients, and hopefully you guys can benefit from that as well. So as always, if you did enjoy this content, if you found it useful, more importantly, please feel free to share this video so others can see. But if you could leave a like and consider subscribing, then obviously it helps us out a lot just to get these messages across. But in the meantime, thanks for taking the time to listen, and I'll see you in the next one.